Boca Raton is in South Palm Beach County, and our market really extends all the way from Palm Beach down through Palm Beach County into Broward County and then into Miami-Dade. There are about 6.5 million people in that very densely occupied area. Being on the south end of Palm Beach County, we're right in the middle between Palm Beach and Fort Lauderdale in a very densely populated area. It has high seasonality. Many condominiums up and down the beach where people come in the winter time. It's an older demographic, very high Medicare dependence. For instance, in our immediate market for our hospital, more than 65% of our patients are Medicare. And mostly Medicare indemnity, not Medicare managed care, primarily because they're wealthier individuals that are not cost sensitive. So seasonality and Medicare dependence are really two of the unique characteristics of our market. In about 2005 and 2006, the hospital began to lose money. As the hospital progressed and filled those shortfalls with some of the savings that it had, what they didn't realize is that things were getting worse and worse. And then in 2008, the hospital incurred a $120 million loss on about $350 million of revenue. So it was a very, very significant loss. At that time, the board decided to make a management team change and brought in a turnaround team, and I was a CEO on that turnaround team. We started in 2008 to dig out of the hole from that $120 million loss, and we were able to turn the hospital from that loss position to profitability in about 18 months. By 2010 fiscal year, we were break even. And I get asked the question all the time, how do you make that much progress that quickly? You know, in many ways, Boca Raton is unique. I always talk about the uniqueness of Boca Raton. And if you look at other hospitals that are struggling, many times the reasons are predictable. They have a high indigent load or really don't have the ability to invest in facilities. Those were not issues at Boca Raton. In fact, quite to the opposite. Boca Raton was so privileged and had so much money that their fundamental problem was they really didn't pay attention to day-to-day operations. So while I wouldn't characterize the turnaround as easy, it was a lot of hard work and a lot of focus, but it was really back to basics. It was supply chain, revenue cycle, and staffing. And when you got those basics right, the other attributes of the hospital, we have a great payer mix, great philanthropic support, great support by the community. It happened very quickly just by focusing on the basics. Well, Boca Raton had that position of being a favored community hospital, but it was a community hospital. And what I saw very quickly, even as we got to break even, that if we were going to sustain ourselves for the long run, we needed to have a more prominent position in the South Florida market. And we really developed a couple of strategies to achieve that more prominent position. One was moving up the scale in terms of services, tertiary services rather than just community services. So people didn't think that they needed to travel. We were losing some patients maybe down to Miami, but so many more of our patients, quite frankly, as I say all the time, don't choose between me and the next hospital up or down the coast or even Miami. They choose between Boca Raton Regional Hospital and the airport to travel to Cleveland or Baltimore or New York. So moving up the scale of tertiary services and keeping people home was one of our strategies. We've done that successfully. The other was moderating seasonality by getting away from the very seasonal coastal communities. And when I say getting away from them, not that I want to lose any of those patients, but as we grow disproportionately to the western suburbs, where more of the people are year-round residents and year-round residents, working class, so they are not Medicare yet, a little bit younger. And we deployed that strategy very effectively as well. Changed the name of the hospital from Boca Raton Community to Boca Raton Regional back in, I think, 2011. And to the outside observer, that may not seem like such a big deal. I was actually somewhat hesitant to raise that issue with the board because if you understand the real ownership that this community feels about the hospital, I was afraid that they would react negatively to it as if we were stepping away from the community. But I made the case to the board that if we continued to exist as a community hospital, then our continued existence was actually threatened in the long run. And if we were going to be there to serve the community, for the long run, we need to have a bigger footprint. They endorsed it enthusiastically, and we've had great success since then. One of the great things in terms of moving up the technology scale and having tertiary programs is we have the resources to be able to do those. Many of our seasonal residents are very wealthy. Many of them can get on their private jets and go to anywhere in the world that they want to for great health care. Many of those residents also know that they're spending more and more time in South Florida, and they don't always have the time or even the desire to travel if they can have access to great care in South Florida. So through their philanthropic support, we're really the technology leader in many, many services in all of South Florida. There are more than 75 hospitals from Palm Beach to Miami, and we're the first in flash CT, first in intraoperative MRI, and intraoperative CT. And in fact, there's only one other center in the entire United States that have both of those technologies in an OR, and that's at Duke University Medical Center. So we've been a first in investing in that higher level technology. Da Vinci robots, we're now the largest robotic surgery center in Palm Beach County. Our Women's Institute serves 100,000 women a year, one of the biggest institutes in the entire United States. And it's very much based around high-end, best technology, and then marrying great clinicians to it as well. There are so many patients from the greater New York area that travel to Boca Raton seasonally. And not only Boca Raton, to Palm Beach and Broward counties, actually preferentially out of all of the state of Florida. So when we looked at the demographics, we saw an opportunity on the Boca Raton side to gain some additional patient volume. And I think North Shore LIJ saw on their side an opportunity as they look to really creating value for patients and managing their care over time, and particularly since they have their own insurance product, to create a relationship with one high quality, reasonably priced hospital like Boca Raton to both enhance the quality of the patient experience by coming to an organization that focuses on quality and patient satisfaction, by enhancing the portability of medical records through electronic transfer between New York and Florida that's available both to the physician and to the patient, and by reasonably managing costs. So it's been a great partnership. It's been in existence now for about a year. I couldn't be more pleased with it, and I think we're just really getting started.